Hello, I'm Dr. Rob Williams with New Life Center for Bariatric Surgery here in Knoxville, Tennessee, and I want to talk to you a few minutes today about duodenal switch procedures. We get a lot of questions about the duodenal switch because, frankly, not a lot of surgeons do the operation. We do it here in Knoxville, and I think I'm the only guy who does it here. There may be somebody in Asheville or Memphis, but we get a lot of questions because there's confusion and some of the data on the internet is not always very clear. So we have two duodenal switch procedures. The oldest is called the Biliary Pancreatic Diversion with duodenal switch. You'll see it called the BPD, the DS, or the switch procedure online. But there is also the SADI, which is called the single anastomosis duodenal ileal bypass. Because I'm going to show you both of these procedures today and try to explain the difference really quickly and concisely. So with the SADI, single anastomosis duodenal ileal bypass, we do a sleeve gastrectomy, which limits how much food you can eat, and it also limits your appetite. Now, normally, when food leaves your stomach, or if you've had a sleeve when it leaves your stomach, it enters the small intestine in the duodenum here, where it begins mixing with digestive juice, and then it travels through 20 feet of small intestine before it gets to the end of the small intestine. And that 20 feet of small intestine is where your body absorbs the calories and the nutrients with the assistance of those digestive juices. So with the SADI, after we've done the sleeve gastrectomy, we're going to cut the intestine before the food gets to the digestive juice. The digestive juice is going to roll downstream by itself for about 12 feet. At that 12 feet mark, we connect the sleeve back to the intestine. That allows the food to drop into the intestine, meeting up with digestive juice, and then the food and digestive juice, will be able to mix for the last 8 feet only of your intestine. So the bottom line is with the SADI, you get full quicker, you have less appetite, food gets from your stomach to the end of your small intestine quicker, which means you don't absorb all the calories fully, but it also probably speeds up your metabolism, and the weight loss is excellent. It's usually better than a gastric bypass. Now the other operation that's a close cousin to the SADI is what we mentioned before, the Biliary Pancreatic Diversion with duodenal switch, or the BPD as I like to call it. Now the main difference between the BPD and the SADI is there's an additional anastomosis or connection. So when we're doing a BPD, we do all the steps of the SADI that I've already mentioned, but once we've completed it, we cut the intestine here before the digestive juice gets to the food, and we reimplant that digestive juice limb 3 feet from the end of the intestine. So what happens after a BPD is that you have the sleeves, so you get full quickly. The food's going to drop into the intestine, but there's no digestive juice for the first 5 feet of that 8 feet. And for the last 3 feet of the 8 feet, digestive juice will mix with food. So there's actually less mixing of food with digestive juice after a biliary pancreatic diversion with duodenal switch than there is with the SADI. That's the primary difference. Thanks for joining us. I'm Dr. Rob Williams with New Life Center for Bariatric Surgery in Knoxville, Tennessee.